Today, I would like to discuss diagnostic and therapeutic approaches for the management of lumpy skin disease in bovine, especially the differential diagnosis of lumpy skin disease. You all know that this is a emerging disease in Asian countries. So, lumpy skin disease, as regards the history, this disease is endemic in African continent, and it was first time recorded in Zambia in 1929, and it was restricted to Africa up to 1978. Later on, it spread to the Middle East and then to the Europe. And last year, the cases were recorded in outbreaks were recorded in Bangladesh, followed by India. Now, the disease is highly host specific, and disease affects primarily to the cattle. Very rarely it has been recorded in buffaloes, although buffaloes they are susceptible to this LSD. Sheep and goats they are unaffected. Sheep and goats are unaffected, even they are kept in close association with the cattle and buffalo. Extensive serological surveys they indicated non-involvement of the wild ruminants. The disease is not having any zoonotic importance. As regards the breed, the disease is more common in exotic and crossbred animals, especially the severity is more in crossbred animals. All age groups, they are susceptible, but disease is more severe in young animals or cows. There is no as such predilection, but more number of cases we have recorded in bullocks. The disease occurs throughout the year, but it is more common during the rainy season because of increase in the fly population. So many of the outbreaks they were recorded during hot and humid climate, although the disease is occurring throughout the year. I will be covering the disease aspects in brief because I would like to give more stress on the differential diagnosis. So high yielding animals, they are more susceptible as compared to the low yielding animals. The morbidity percentage in case of LSD was recorded as 2 to 45%, but mortality is very negligible. It is around 1 to 5%. And the mortality is mainly restricted to the cows and very rarely in adult crossbred animals. The disease is economically very important because it is characterized by reduced production in the lactating cattle. There is a progressive loss of body weight because of a longer course. In young animals, there is a retarded growth. There is a permanent damage to the hide because of skin lesions. The animals may show the temporary infertility or unestrus condition. Some pregnant animals, they are likely to abort. In bullocks, particularly, there is a loss of drop power due to lameness, and even indirect losses, they stem from restrictions on cattle movement and trade. The disease is caused by caprivirus belonging to the family Poxviridae. This is a large double-stranded DNA virus, antigenically similar to sheep and goat pox virus. This is very important. So this LSD virus is antigenically similar to sheep and goat pox virus. There is only one serological type of LSDV, and these three viruses, LSD, SPP, and GTP viruses, cross-react serologically. This virus is susceptible to heat, and at 65 degrees centigrade for 30 minutes, this virus gets inactivated. It survives in skin at minus 80 degrees skin, particularly scabs, for at minus 80 degrees centigrade for 10 years, and in infected tissues at 4 degrees centigrade for months together. The virus is susceptible to alkaline as well as acidic pH. It is a virus is also susceptible to the formalin 1% of sodium hypochlorite 1 to 2%. The virus is also susceptible to sunlight and detergents, but in dark environmental conditions, particularly in a contaminated cells, it persists for many months. The disease is transmitted mechanically by the arthropods belonging to, see this category, belong to the genus Stomachsis. That is a Stomachsis calcitrans, or a stable fly. This is mainly responsible for the transmission of this disease. Even culicoids, mosquitoes, and ticks, they can transmit the disease. But biting flies, they occupy number one position. And therefore, it is called as a vector-borne disease. But apart from vectors, rarely disease is transmitted even by other routes. Direct contact is considered as a route of infection, but it is ineffective route of infection. Direct contact with the diseased animal. Natural mating or EI may be a source of infection for females. Through semen, the disease may be transmitted, the rare chances. Infected pregnant cows are known to deliver calves with skin lesions. Suckling cows, they may pick up, here I have given the photograph, that suckling cows, they may pick up the infection from a cow through milk, or maybe due to, you can see the teeth lesions or other lesions. Virus is present mostly in the cutaneous lesions, and it is also present in all secretions and excretions during the phase of viremia. Usually, it lasts for 7 to 8 days. So virus can survive in a desiccated crust up to 35 days and 18 days in air-dried heights. So these are the features of the virus which are responsible for persistence of the infection in the animal cell. It is interesting to know how the disease spreads over a short distance or a long distance. See, short distance spread is resulting from the biting, you can see the insect, like of mosquitoes, see the ticks and the flies. They can spread the disease in the animals within the herd or a neighboring herd. But the disease can spread to a long distance. When the animals, they are, you see, the affected animals, they are transported to a new place. So through vehicles, they are being usually transmitted. So they are, along with the animals, even the flies, they are being carried. And these infected flies and infected animals can transmit the disease to the healthy animals in a newer area. The flies, they can also fly for a long distance, and they can spread the disease. The clinical signs, you see, the incubation period of this disease is around 1 to 5 weeks. But in general, it is 1 week. In general, it is 1 week. And the disease starts with a febrile reaction. So that is the first stage of the disease. And this stage may last for 1 to 3 days. Usually in indigenous animals, local breeds of cattle, we have seen it is lasting for just 1 or 2 days. Sometimes even it goes unnoticed also. In crossbred animals and cows, it may persist for 1 week. Depending upon fever, the appetite, water intake, they are affected. In a febrile animals, water intake and feed intake, they are reduced. Milk yield is also dropped. The animals which are showing a very mild thermal reaction or which are exhibiting a normal body temperature, they continue to eat, they continue to drink water, and therefore the disease appears to be very mild. Lacrimation and nasal discharge may be watery in the initial stage. Later on, the nasal discharge may be purulent once there is a, you can say, pneumonia. Necrotic ulcers in the oral and nasal cavities, they are rarely encountered, but particularly in case of young people, see the lesions may develop in the nostrils, and rarely even in adult animals, the lesions may develop in the mouth cavity. Abortion, infertility, death may occur very rarely in a complicated cases. Recovery usually occurs within 2 to 3 weeks, just like a pox. The cardinal finding or the characteristic lesion of the multiple nodular swellings. Size, it varies from 5 mm to mm. That is 5 just half centimeter to 5 centimeter. The sites, actually, the lesions, they appear over head, neck, back, chest, limbs. Generally, they are appearing all over the body, and they may appear over vulva as well as udder and scrotum. Scrotum in male animals. The nodular lesions, they are very firm, they are round and raised above the skin. They may involve the skin. Usually, most of the lesions, they are present within the skin and they involve some subcutaneous tissue. But larger lesions, they are deeper and even they sometimes involve the muscles also. Initially, the nodular lesions are there, followed by some scab formation, removal of scab, ulcer formation, and then again a thick scab formation and a scar formation. The lesions, they heal by scar formation. Here, I would like to show you see the nodular skin lesions. They vary from case to case. In this bullock, you will find a few number of nodular lesions, maybe of small to moderate size. You see here generalized lesions. In general, in cows, the lesions are severe, extensive, and they are larger. In both the calves, you can see the lesions, they are big in size, and they are more in number. Here also in adult bullocks, usually the lesions are not, you see the number of lesions are comparatively less. But you see this bullock is showing the thousands of lesions over the body. Those are small in. I would like to bring your attention to this photograph. This shows the nodular lesions. See, this is a big nodule, maybe having a diameter of 4 or 5 centimeter. Here again, you can see a bigger nodule. Here also there are moderate sized nodules. Whenever big nodules they appear, usually in a few cases, such few number of big nodules may appear. In those cases, usually the ulcer formation is very common. Another characteristic sign of LSD is an enlargement of lymph node. Invariably, lymph nodes are enlarged in LSD. Enlargement may be severe in a severe cases, or when the lymph nodes are severely enlarged, we can say that's a severe case. Here you can see the prescapular lymph node is enlarged. Here also prescapular is enlarged. Here it is a prefemoral is enlarged. Here also prefemoral lymph node is enlarged. One more interesting thing I would like to share, in LSD, these type of complications, they are occurring. Here you will find a cord-like structure which is connecting number of nodules. See here, you will find 4-5 nodules that are connected by a part. Maybe a lymphatic vessels, they are getting enlarged. The lymph node enlargement may be developing. Here also you see it is connected to lymph node. And you will find a number of lymph nodes, number of nodules. Those cases are difficult to manage. Again, here you will see the brisket edema as well as swelling over the limb, brisket swelling. This is again a characteristic. These type of the signs are observed in 5% cases. In some cases, you will find ulcerative lesions of muzzle and even the lips and the inner side of the mouth. Again, the ocular lesions are very common, particularly in the calves. In 20% cows, the ocular lesions are likely to develop if the cases are not treated in time. And initially, there is a watery discharge, serous discharge. Later on, it becomes a purulent. The eyelids, they get plucked together, and there is a purulent type of the discharge, and even the opacity will develop, and there may be a blindness. See, in adult bullocks also, in 1 to 2% cases, the ocular lesions may develop. Here you can see the opacity, corneal opacity is there. Other lesions may develop in a cows, female animals sometimes, and here you can see the other lesions. They may get complicated, and ulcerative lesions may be formed over the teeth also. So how the lesions they progress initially nodular lesions, and then they see the scabs and the scab removal, and again the ulcerations will be there, and then the lesions will heal. We can also find complications in some animals. particularly those animals which are treated in the late stage. Such type of lesions will develop. Nodular swellings may get necrosed and ulcerated. So yeah, skin slough will occur and the lesions, there will be an open wound and that will heal. Here also you can see a open wound. Here also you can see a open lesion. Here you can see the lesion. Here you see a very deep lesion, ulcerative lesion. Maggoted wounds are likely to form in such type of the cases. Rarely the disease occurs in case of the buffaloes. The diagnosis, in my opinion, is a very easy. History of occurrence of the disease in maybe in a nearby village, in the particular village, the characteristic signs which include the multiple nodular swellings on the body may be accompanied by fever. Hematological examination usually reveals a leukopenia as well as thrombocytopenia, mild thrombocytopenia and leukopenia. These are the characteristic features of the viral disease. Biochemical findings usually indicates the increased oxidative stress. Confirmation is done by RT-PCR. The best sample or the ideal sample is a skin, you can see the scab or a nodular lesion skin biopsy is the ideal sample. The next sample, which is useful, that is the nasal discharge or nasal swab has to be collected. In whole blood, you see that is not a good sample, but that sample can be used even for isolation of the virus as well as for hematology and serology. Now I'm coming to the differential diagnosis of LSD. See, the LSD is characterized by the cutaneous lesions, and you have seen so many good pictures of cases having the skin lesions. And this LSD needs to be differentiated from these three viral diseases, which are characterized by the cutaneous skin lesions. So pseudo-lumpy skin disease, that is also a bovine herpes virus mammallitis. So bovine herpes virus mammallitis is restricted to the udder and teeth. Usually the lesions, they are over the teeth. And the course of the disease is shorter. The lesions are superficial. They are not very nodular. They are not nodular and they are not deep. They are not involving the subcutaneous tissue or muscles. So they are comparatively superficial. The course is shorter and the disease is less severe and the lesions, they are restricted to the udder. The lesions are absent over the body. So this is the way to differentiate. Then pseudo cowpox, it is also occurring in cows particularly, and the lesions again they are restricted to the teeth and udder. They are restricted to the teeth and udder. So the lesions may be just like pox, they are developing over the udder. So erythema followed by you can say a small elevation, and that is followed by a scab formation. So pseudocowpox. The lesions are restricted to only udder and teeth. They are absent over the body. Then bovine papillary stomatitis. This is caused by parapox virus. The lesions are seen over the, you can see the oral mucosa. Even the lesions may appear over the muzzle. Here you can see the reddish spots over the muzzle, and some lesions may develop over the oral mucosa. And those lesions are papular in nature. They are small, solid elevations, which are, you can say, erythematous or reddish in nature. Paraphilariasis, it is also called as the summer bleeding. And this paraphilaria is sporadically occurring in different countries, including India. And this is characterized, this is the filarial nematode, and this is characterized by a formation of nodular lesions over the skin. And those nodular lesions are usually over scapula, wither, and thoracic region. We have seen generally over the chest region or a wither region, sometimes over even the neck region. And here, maybe one or two lesions or sometimes three lesions, they may develop, and those lesions, they ulcerate and bleeding will occur. Usually, these are a bleeding type of nodular lesions, bleeding nodules. We can call it the bleeding nodules. That is the characteristic feature. Actually, the bleeding nodules, the whatever exudate that is coming, that is mixed with the eggs, and that is an admixture of, you see, blood, eggs, and microfilaria. So the diagnosis can be made based on a skin scraping or exudate smear examination. You can get evidence of microfilaria, and the cases they are responding well to the ivermectin treatment. The demodicosis is the another disease. See, pyrophyresis occurring in all age groups and even in adults. It is being observed. It's a sporadic disease. It is not a highly, you can say, the contagious, and you see morbidity is less. So very sporadic type of the case which can be diagnosed. As compared to the in LSD, usually bleeding nodules are absent. But yes, in a rare cases, the nodules may rupture and they may appear, and there may be a bloody exudate even in LSD. And those cases needs to be differentiated from paraphilariasis. But in case of LSD, we have seen the nodules may develop all over the body, all over the body. Here it is, or the, you can say the dorsal part of the body or the chest. The demodicosis is also occurring in case of the cattle, particularly in young cows. We have come across the cases in young cows. Very rarely it occurs in adults. It is, it is caused by a mite, cigar-shaped mite, that is a Demodex bovis. Here, nodular lesions, yes, nodular lesions, they appear more or less similar to that of LSD, and they develop over the neck region. Mostly, this is the first site, even over the face region, neck region, and that is followed by maybe a shoulder region. Very rarely the lesions, they are being observed over back and flanks, but mostly the lesions, they are over the neck and you can see the shoulder region. The knee lesions, they are nodular in structure, and there is no fever, appetite, water intake, everything is normal. When these lesions are squeezed, see, it's a chronic type of a disease. When the lesions, when they are pressed, squeezed, the pus will come out, and if you take that pus over the blood glass slide, and if you put the cover slip and examine it, you will find thousands of, you can say, the Demodex mites. So it is very easy to diagnose, and it is mostly in young animals. But it may occur in a more number of animals if there is outbreak. But disease is very mild and persistent, and the cases they give response, very good response to the ivermectin treatment. Maybe 2 doses of ivermectin are usually required. Then even a ringworm, actually one cannot face the difficulty in making a differential diagnosis of a ringworm from the you see the LSD, because in ringworm there are no nodular lesions. In a ringworm, just you will find a ring-like lesions. The ringworm is caused by dermatophytes. That's a fungus, particularly a trichophyton. It is caused by dermatophytes like a trichophyton and microspora or epidermatophyton. The lesions are more superficial in nature. They are non-ulcerative. Those are there is usually no bleeding and no exudation. Lesions are very dry. Usually they are dry, they are superficial, they are whitish in nature. Here you can see the lesions are whitish in nature. Usually the lesions, they develop first over the head and face region or maybe a neck region. These are the predilection site for ringworm. Again, the ringworm or a dermatophytosis is common in young cows. Young cows, it is there. Adults are least affected, and the lesions are non-nodular. So this is very easy to differentiate. Then these cases can be very well treated with antifungal type of drugs. Insect bites, yes, insect bite and urticaria. One can get confused with insect bites and urticaria. In urticarial plaques, they develop usually all over the body. And it is an allergic type of the condition. And the cutaneous manifestations, they are in the form of nodules, but usually these nodules, they are having somewhat a flat top, and they are somewhat soft in nature. They are soft in nature. They are slightly inflammatory, edematous in nature, and they are having a flat top. That is a characteristic. There is a sudden onset. There is no fever, and usually the urticarial lesions, they subside. They subside. They give very excellent response to even antihistamine. This may subside on their own, or they give response to even a single dose of maybe a steroid and antihistamine. Insect bite may be the cause of urticaria again. So there may be evidence and a history of even an insect bite that may lead to urticaria all over the body. So there are a number of reasons for urticaria. Usually insect bite or contact with the stinging plant, different type of allergies. Lesions are more superficial, the course is shorter, and the condition is less severe. So this is particularly a condition I have seen that one can get confused with the LSD. I am of the opinion that LSD needs to be differentiated from thalidosis and bovine ephemeral fever, or the diseases which are characterized by the lymph node enlargement, because lymph node enlargement is a characteristic feature of LSD. So it should be differentiated from thalidosis. You know, in thalidosis, the fever is persistent. Already I have shared in LSD, the fever remains usually for 1 to 3 days, very rarely for 1 week. But in thalidosis, generally the fever is a persistent one. So that is the one of the more important differentiating feature. Lymph node enlargement is present, but this is accompanied by anemia. In LSD, usually hemoglobin PC values are normal to elevated in case of maybe dehydration due to reduced water intake, usually normal, sometimes elevated, but they are not declined. But in case of thalidosis, you will find decrease in the hemoglobin and PC value. So mucous membranes, they appear pale. So, and the cutaneous lesions or nodular lesions are absent. We have seen rare cases of thalidosis. I will definitely demonstrate and show you the pictures of the various cases of thalidosis manifestations in my next presentation. Here, just to remember that nodular lesions, they are a characteristic of LSD. In thalidosis, in a rare cases, we have also seen cutaneous lesions. Those are different type of lesions. Those are not nodular, they are more superficial and they are scabby type of a lesion. But again, that is very rare. But that is also accompanied by anemia. See, in LSD, there is no anemia. So, and in thalidia, usually there are no nodular lesions. 99.99% cases, there are no nodular lesions. And in thalidosis, usually there is anemia. So, in this way, we can differentiate on laboratory examination, blood smear examination. You see that smear may be positive for thalidia. Another disease which needs to be differentiated from LSD in the beginning of the illness, bovine ephemeral fever. You know, it is called as a 3-day sickness, and this is also characterized by fever. See, in bovine ephemeral fever also, usually fever lasts for 1 day, maybe 12 to 24 hours. Very rarely it lasts for 48 hours. So there is a transient fever. Even in many cases of LSD, we have recorded a transient type of the fever. It's like a bovine ephemeral fever. So initially, one can get confused. One can get confused because in LSD also there is lymphadenopathy. In bovine ephemeral fever also there is a lymph node enlargement. But and in both the cases, LSD as well as BF, hemoglobin and PC values are normal. But the major differentiating feature is absence of nodular lesions in a bovine ephemeral. You will never find a nodular lesions on body in bovine ephemeral fever. And recovery occurs within 3 days. In LSD, it takes a longer time for a recovery. Another disease which needs to be differentiated, that is bovine malignant catarrh. Again, sporadic type of viral disease. It is a sporadic viral disease. Very rare. It is rare. Although it is a infectious disease, it is sporadic in nature. You may get 1 or 2 cases. So it doesn't occur in an outbreak form. So this is one important characteristic feature. The another interesting feature is the presence of high persistent fever. High persistent fever, you see in DMC, it has been mentioned that the fever lasts for 19 to 20 days, means 2 to 3 weeks. And that is followed by diarrhea, that is followed by oral or ocular lesions, and nodular lesions are absent. Nodular lesions are absent. This is again very clear. Ocular lesions may develop, oral lesions may develop, and sometimes in the nervous form of the disease may be occurring. The another which is characterized by again a lymph node enlargement that needs to be differentiated. In my opinion, we are getting such type of the cases under the field conditions. Lymphosarcoma, It is you see the cancerous disease, lymphoproliferative disease. Uh, and this is having a chronic course, and there is a painless swelling of the lymph node. This is important. There is no inflammatory swelling, and nodular skin lesions are absent. Chronic course is there. There is a progressive loss of body weight, and there is no response to buparvacin. So as against generally lymphosarcoma gets confused with filariasis. So these two conditions needs to be differentiated. Filariasis is characterized by fever and lymph node enlargement, whereas lymphosarcoma is usually characterized by only lymph node enlargement, and it is a long-standing. There, anemia develops rapidly. Here also, anemia is likely to develop, but it develops very slowly. It develops very slowly, and the blood smear is negative for filaria. Lymph smear, where positive for coach blue body, which is negative for coach blue body. There may be evidence of you can say the lymphoblast. So lymphosarcoma is the condition. Here you can see this is the blood which is showing a progressive loss of very chronic case. This is the same animal. Here you will find enlargement of the peripheral lymph node. Here also you will find you can see the enlargement of the prescapular node. Both lymph nodes they are enlarged, and there was no response to the buparvacin treatment. Lymphadenitis may occur because of bacterial infections, and that is also characterized by lymph node enlargement. Initially, there may be involvement of a single lymph node. Later on, that infection may go to the next lymph node also, and even more number of lymph nodes they are involved. The lymph node enlargement is there. Initially, inflammatory swelling is there. That lymph node may be acute inflammation is there. Painful swelling is there. The adjacent tissue may get swollen. And once it becomes a chronic, even mature, and if you prick the needle, pus may come out. Here, I have shown the case of, you see, the lymphadenitis, and that's a chronic, and that's a purulent type of a lymphadenitis. Usually, these type of lymphadenitis, they are caused by maybe a bacterial infection, bacteria like a Corynebacterium pyogenes, sometimes actinobacillus, even actinomyces may cause, even Pasteurella may cause the such type of lymphadenitis, maybe over the head and face region or in the, you see the prescapular region. Ulcerative lymphangitis may be caused by Corynebacterium pseudotuberculosis in cattle, and this is characterized by lymph node enlargement as well as the enlargement of the lymphatic vessels. So you will find a thick cord-like lymphatic vessel, just like lesions we have seen in LSD, where the lymph node is also enlarged and there are tortuous and thickened, you can see the cord-like structures. So such type of the lesions may develop in ulcerative lymphangitis, but in ulcerative lymphangitis, the lesions and there you will find ulcers. You will find ulcers over the lymphatic lymph vessels, those thickened cords, and there may be a drainage of you can say honey-like pus, or maybe even it depends upon the positive organism, purulent pussy discharge or purulent, and there may be a lymphatic obstruction, and that may result into a swelling in the adjacent area. In my opinion, again, the cases of LSD needs to be differentiated from the pericarditis and snake bite, where there is a brisket swelling. Here you see the bullock, which is showing the brisket swelling. But here I would like to point it out. Like that, I cannot point it out with the arrow. But you see in pericarditis, also you know that there is a brisket swelling. Brisket swelling is a characteristic of pericarditis, and sometimes there may be swelling over legs. But in general, the swelling over brisket is a characteristic. Very rarely the lower limbs are swollen. But in case of LSD, we have seen brisket swelling with the swelling of legs. Again, there may be, usually we have seen brisket swelling with the swelling in one of the legs, sometimes in both the legs. So both possibilities are there. So those cases needs to be differentiated from pericarditis. But the characteristic feature of the pericarditis is that the along with brisket swelling, you will find the jugular vein is enlarged. The engorgement of the jugular vein. Without giving any pressure, the jugular vein appears to be engorged, and that is the clear. Even in this picture, you can see the engorgement of the jugular vein. And another characteristic thing, finding there are absence of the nodular lesions over the body. So one can easily distinguish. If you put the stethoscope over the cardiac area, you can find three types of the sound. Initially, you may find a dry or a rubbing type of the sounds. Somebody has put this question and demanded how to diagnose the diseases of chest based on the auscultation finding. I'm of the opinion that we can make a best use of stethoscope for diagnosis of diseases of chest by you see auscultation, and cardiac diseases can be very well diagnosed. So in the beginning of the pericarditis, there are dry sounds. The parietal, you can see the layer of the pericardium, and may glide over the visceral layer of the pericardium, and there may be a rubbing type of the sound. Initially, it is observed, and during that stage, you will not find any edema, brisket edema or enlargement of the jugular vein. So you can diagnose pericarditis in the first stage before appearance of the brisket swelling very well by using the stethoscope. During the second stage, the fluid gets accumulated in the pericardial cavity, and the fluid gets accumulated. Once the fluid gets accumulated, the splashing type of the sound is being heard. That is very characteristic. And slowly, the pericardial fluid is getting accumulated, and then the pericardial cavity will be full of pus or fluid. In that case, you will find a muffled type of the heart sounds. The heart sounds may not be audible, may not be clearly audible. So you can diagnose the stages of pericarditis very well by using stethoscope. Here also, by using stethoscope, if there are no abnormal sounds, the possibility of the pericarditis can be very well ruled out. Then the next condition which needs to be differentiated when there is a swelling over brisket and leg. Here you can see a very interesting and a very good picture of a snake bite in a bullock over the leg. Here you will find a brisket swelling and there is a swelling over the legs. Here there is a sudden onset, no fever, nodular lesions are absent, blood clotting time is a characteristic, it is prolonged, thrombocytopenia is very severe, lymphadenopathy is absent. Here you will find absence of lymph node enlargement. These are the characteristic features of the snake bite. And the most important feature, which I told in my first lecture, that this swelling is ascending type of the swelling. So you will find a swelling which starts from the lower limbs and it extends to the upper part, may go up to the shoulder and then descend down to the brisket. This is a characteristic feature of, you can see, the snake bite. Whereas in case of LSD, the swelling usually appears near the lymph node, prescapular lymph node, brisket, and that descends down. Because in LSD, where the lymph nodes are enlarged, adjacent lymphatic vessels may be getting blocked to some extent, and the fluid is getting, you see, accumulated. And so that may be the reason for the swelling which is being observed in case of LSD. Then, without brisket swelling, I see the swelling may appear on the hind legs also. In LSD, the swelling may appear on hind legs. The front leg may not be involved. There may be involvement of one leg or another leg. There may be involvement of the one leg or another leg. And in that case, you see, you have to differentiate it from the snake bite. Here you can see a very interesting feature. Wagmare sir, is there any problem?
No, sir. Please continue, sir.
Yeah. See, there is a swelling over the hind limb. You can see how, again, there is an ascending type of the swelling, which is up to the thigh region. And this is a very characteristic feature. In case of the LSD, swelling is milder and lameness is prominent. We have also seen some cases wherein there was a swelling over the lower limbs, and there were slight nodular type of a very superficial type of the mild type of the swelling, and there is involvement of lower limbs below knee. Sometimes maybe all four legs, or sometimes only hind legs they are involved. Usually hind legs they are involved, and those cases were found positive for microfilaria. and they responded well to the, you see, the ivermectin treatment. So this is all about the differential diagnosis. Actually, here I have discussed so many disease conditions purposefully, but I don't think LSD is difficult to diagnose. It is difficult to diagnose. In brief, I will discuss the treatment aspect of LSD as it is an emerging problem in India and Southeast, you can say the Southeast Asia, and therefore we should discuss. We will discuss treatment aspect. Actually, being a viral disease, there is no specific treatment, but the treatment, symptomatic treatment, if it is done in the initial stage, definitely we are getting a very good result, and there is a rapid recovery, and we can prevent losses of the farmers to the great extent. Administration of antibiotics for 5 to 7 days. In rare cases, the antibiotic needs to be continued for 10 to 12 days. In that case, generally, I used to shift from one antibiotic. First, we are starting with enrofloxacin, maybe for 5 to 7 days. In a complicated cases, we are going maybe for a maybe amoxicillin sulbactam or maybe a ceftriaxone tazobactam. And in pneumonic animals also, maybe we are going for ceftiofur tazobactam. So these type of the preparations can be very well used depending upon the severity. In case of pyrexia, we are giving meloxicam plus paracetamol. Otherwise, we are giving just the meloxicam for 5 to 7 days, and that is really a very good result. Then, in a chronic type of the cases, wherein there is a lymph swelling and there is a lameness or lymph swelling, we are using maybe a meloxicam plus ceratopeptidase or nimesulide plus ceratopeptidase, maybe for 1 week. After completion of the you see the course of antibiotic and maybe a course of antibiotic with the NSAID. Antihistamine, they are to be given regularly till the lesions subside. Maybe any CPM like GT injection that can be continued, 10 ml at the rate of 10 ml intramuscularly, or 5 to 10 ml, depending upon the body weight, maybe for 5 to 10 days. Multivitamins can be very well used. Vitamin B complex, they are very useful. They will reduce the stress, rejuvenate the animal. With a dose of a single dose of vitamin AD can also be given. And I prefer this immunomodulator as a vitamin E and selenium immunobooster for boosting the immunity. A single dose of vitamin E and selenium at the rate of maybe 1 ml per 50,000 body weight subcutaneously. That really helps in boosting the immunity. In the cases where brisket swelling is present, edema of the limb is present, we can use diuretics for 3 to 5 days, maybe a furosemide, 1 to 2 milligram per kg body weight in edematous swelling. Corticosteroids I have rarely used. I don't recommend corticosteroids because they cause the immunosuppression, and they are you see in cases of LSD with thaleria, LSD with SARA can develop, or any other infections can flare up because of you see the use of steroids. I have seen those who have used steroids in high doses for a longer period. There were more complications. So try to avoid steroids only in the cases of severe pneumonia, wherein there is respiratory distress. Condition is worst. You can use dexamethasone as per requirement, maybe for one. You see, maybe may not be more than 3 days. Magnesium glycerin paste is also working well. Or we can apply this magnesium glycerin paste for the swellings, or the maybe swelling which are appearing over the limbs. Eye drops containing antibiotics and steroids can be very well used, or subconjunctival injections of gentamicin plus dexamethasone, 0.5 ml each, can be given for 5 days. So there is good response to the treatment even in case of corneal opacity. Wound management is very important. When there are open lesions, ulcerative lesions, and particularly bigger lesions, they are ulcerate. In that case, use of you have to clean it, and you have to use the antiseptic sprays, fly repellent sprays, twice or thrice in a day, so as to prevent complications like maggoted wounds. Mouthwash with PP lotion and application of boroglycerin in case of mouth lesions. That is a rare thing. But in cause, I have seen the lesions, they may develop scabs may develop in the nostril because the nasal discharge will get dried up, and that plugs the nostrils, and therefore The snoring respiration is observed, respiratory distress is observed in cows, particularly showing the signs of pneumonia. So in those cows, generally installation of a few drops of you can see the sweet oil, the lukewarm sweet oil, or maybe a glycerine, few drops in both the nostrils may have a soothing effect, and that will give relief from the scab formation and the respiration. Animal can respire with ease. In cases of pneumonia, in case of the cows, prolonged treatment is required. And generally, I prefer, you see, except like you see, preparations. Those can be given over a period of just 500 milligram. That is sufficient for maybe a 5 to 6 days for a particular calf. So that type of preparations can be given. So I know it's now a high time, but within 5 minutes I will conclude. The prevention and control of vector is important, because that is the main, you can see the root of infection, way of infection. But isolation of animal has to be carried out. Then the movement of human beings to and fro from the shed should be controlled. Then the cattle markets and fairs should be stopped. Then within the radius of 10 kilometers, dead animals should be buried deep, and all sanitary type of measures they are to be taken by using the sanitization with the sodium hypochlorite. And vector control is the most important. Being a vector-borne disease, vector control is important. And for vector control, cleanliness of the shed and cleanliness of the premises is important. Disposal of dung, because dung is the breeding site for the flies, and therefore covering the dung with you can see the polythene, that will prevent the breeding of the flies, and you see new crops of flies. Fill up the cracks and crevices so as to control the ticks. Sufficient sunlight is to be, there should be a sufficient sunlight and ventilation that will reduce the fly population in the shed. Now, when the shed is a closed one and it is in the dark, the organisms also persist for a long time, and even the flies population will get increased, and you see they will bite the animal and transmit the disease. Insecticide spray in the shed as well as on the body. Ivermectin injections, they are beneficial even in cases of LSD. I recommend a single dose of ivermectin to animals suffering from LSD, and even to the animals which are very adjacent to the case or in a close vicinity of the you see the yelling animal. The vaccination is the best way to control the disease in a disease-free area, particularly you see within the radius of 5 kilometers. The vaccination should be carried out, and Pomulatus light attenuated virus vaccine, Methylene vaccine. That vaccine is not available in our country. In Africa, it is being used. Goatpox vaccine is also a safe vaccine. Goatpox, sheeppox vaccine can be used, but goatpox vaccine with Uttarkashi strain is being recommended in our country, and it is widely used, and it has given very good results also. The dose is debatable. The dose for goat is 1 ml, but we are recommending 2 ml for the cattle, at least 2 ml subcutaneously in the neck region. All cows about 2 months, they are to be vaccinated. Actually, live vaccines are not recommended in the pregnant animals, but this vaccine is proved safe in the pregnant goats, and even in large animals. I have not come across with any, you can see the report of abortion due to vaccination. So, although it is not studied in cattle, so we cannot strongly recommend, but as far as our experience is concerned, this vaccine can be very well used in a pregnant animal safely, with a very little or negligible type of a risk. So vaccination will definitely help in prevention of this particular disease. So this is all about LSD, and particularly the differential of diagnosis of the disease is characterized by lymphadenopathy, diseases characterized by Brisket swelling, and diseases characterized by even the cutaneous lesions. So thank you.
Thank you very much, sir. Are there any questions in the chat box? Please share this question.
Yes,
Dr. Professor Vaccination, sir.
Yes, sir. Yes. There are totally 3 questions, sir. Rest all questions are there, but you have given the answers to that questions during your presentation, sir.
Yes. Is there any neurological? This is a good question from Dr. Utpal. Yes, in some cases, rare cases, the neurological signs they have also been recorded. Posterior weakness, yes, I have also observed, but that is again a very rare. Maybe one case in a 300 or 400 cases that is there. But in literature, there is no explanation for these neurological symptoms. In cases of LSD accompanied by Sarah, Dr. Jadhav has recently recorded such the cases that would give. So in cases of LSD, they have recorded even Sarah also. So probably the complications are likely because many of the field people, they are giving dexamethasone or in steroids in cases of LSD. That may be resulting into the SARA and even LSD like theileriosis like complications. So we'll have to rule out. We'll have to rule out. But yes, neurological symptoms. In case of theileriosis, in spite of giving bupropion, still fever persists the next 3 or 4 days to manage. Actually, 48 hours we'll have to wait, and after 48 hours, if there is no improvement, we'll have to give even a second dose of bupropion. There are records and reports. Some workers have given even number of doses, but 2 doses are required in a few cases. 2 doses are required in a few cases. Usually, in many cases they respond to single dose. In a severe cases, or where there is breakdown in the immunity, compromised animals. Second, sometimes third dose is also required. This is one thing. Second, the many times, in at least 10%, 20% cases, theileriosis is accompanied by anaplasmosis, or there is a mixed infection of theileria and anaplasma. In those cases also, even after giving bupropion, the temperature doesn't comes down. So in those cases, you will have to give treatment for anaplasma, then there will be an improvement. Sometimes, very rarely I will tell, even theileria may be accompanied by babesia. In that case, you will have to give babesiocidal drugs. So first, we have to rule out whether there are concurrent infections or not. In absence of concurrent infections, we can go for a second dose of bupropion, and in presence of concurrent infection, we can give babesiocidal drugs or you can say the drugs which are effective against anaplasma. Is there any possibility of encountering subclinical theileriosis along with clinically visible? Yes, there are chances, great chances, I will say, because in LSD there is a immunosuppression. Whenever there is immunosuppression, the theileriosis infections, they are always the hemoprotozoan infections, they are likely to flare up. And those cases, see in LSD also, when there is a persistent fever, CBC must be done. And on CBC, if there are low HB and PC value, they will indicate theileriosis in absence of blood smear examination, and you will have to treat for theileria or anaplasma. Next.
Sir, last question is there in the chat box that is there any homeopathy drug which is effective in cases of LSD?
I have not tried any homeopathy drug, so I cannot answer.